Hi, I'm Dr. Julie Steinauer. Today I want to talk to you about something that's really frustrating for a lot of parents, which is lens prescriptions for their kids that just keep increasing every few months, every 6 months, or every year. Now, before we discuss that, let's talk to you about how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You can do one of two things. You can either fill out a questionnaire and maybe get some feedback about your vision, or you can schedule a consultation time directly with me to find out how we might be able to help you. Now, let's go back and talk about that frustrating cycle of never-ending increases in your child's lens prescription. I want to first talk about farsightedness, which means that they have a difficult time focusing up close, and they require a lens that is a positive lens or a magnification type of lens, and so it's going to be a plus lens when you look at the lens prescription. So if you've ever had their lens power increase, where maybe they were a +3 before, now you're going in and the doctor's saying all of a sudden they need a +450 or a +5, and oh, by the way, the higher that lens prescription goes, there's more astigmatism, which is the shape of the eye or distortion of the image that the eye is seeing. And it just keeps increasing along with the more plus power that is gained. Those two things do go hand in hand. The higher the plus power that goes, typically there's more astigmatism that also goes along with it. Now, on the other end of the spectrum are nearsighted kids, kids who have a tough time seeing at distance. And the problem is if they're wearing their glasses for everything that they do, including all of their near work, homework, reading, playing on their phones and gadgety devices, that you're going to see that increase in nearsightedness occur somewhat rapidly. So how do you stop this crazy making cycle of lens prescriptions that's changing all the time? Well, sometimes there are some normal changes that do occur. Usually about 1 notch or 0.25 of a change per year in nearsightedness is pretty average, and most kids are going to experience that, but I'm talking about they gained by 0.75 or 1.00 or 1.50, or they doubled. I'm talking about larger increases, or maybe just the continual increase all the time and it just never ever seems to stop. Those situations do indicate there's a problem with the way that your child's using their vision. And even if we're talking about astigmatism or farsightedness, this still applies. So we're talking about all three of those components: nearsightedness, farsightedness, or astigmatism. They all apply here. It indicates if your child's prescription is growing, and increasing, that they have a problem using their two eyes together as a team binocularly. And what that means is that it's putting so much stress on the visual system. A side kind of repercussion or thing that's occurring is that their lens prescription is increasing. What do you do in these circumstances? You certainly have the option of increasing their lens prescription all the time, but that gets frustrating, and people usually want to get off that hamster wheel of increasing the lens power all the time. The only way to truly do that and to stop things kind of in its tracks is to address the problem with the binocular vision issue that's going on in the background. If they've not been diagnosed with problems using their two eyes as a team, it's simply because emphasis has not been put on that. Maybe it's not been tested, or maybe that's not the doctor's specialty. Maybe they didn't even look into it. But generally speaking, if we're seeing this increase all the time, that's a constant, ever-changing problem with their lens prescription, it does tell us there's a binocular vision problem that needs to be looked at, addressed, and resolved. Once you get to the root of the problem, you should see a stabilization of the lens power, or at least it should not be increasing by these large, voluminous jumps all the time. There are things that you can do to slow that down or get it to stop altogether. Again, one, addressing the binocular vision problem through syntonics and vision therapy. Two, there are some visual hygiene things that can be recommended to tell kids to take more breaks, or maybe not do 6-7 hours on their iPad or video games. there are different visual hygiene things that can help reduce the increase of astigmatism, nearsightedness, and farsightedness. So for more information about how we get you off of this hamster wheel of increasing lens prescriptions, you can go to our website at visionforlifeworks.com, fill out a questionnaire, or schedule a consultation directly with me. But if you happen to be local, you can just give us a call at 618-288-1489. As always, please like the video if you like it. Hit that subscribe button so you get all of our video notifications. And if you feel like this is important enough to pass on to someone who could benefit from it, please do that. Thank you.